Well, our top focus continues to remain India's Omicron tally, which is steadily rising with fresh cases of the new variant being reported across Maharashtra, Rajasthan and Delhi. In the last 24 hours, India has reported 17 cases of the Omicron variant. There's 7 cases in Maharashtra. 9 members of a family have tested positive for Omicron in Jaipur. 1 man has been found positive with the Omicron variant in Delhi. These are just the official numbers basis genomic surveillance data that is now coming in. So this has taken the total count of Omicron cases in the country to 21, and 17 of these cases have been reported, like I said, in just the last 24 hours. Meher Pandey, my colleague tracking the details of this story, joins us this morning. Good morning, Meher. It isn't good news as far as the Omicron tally is concerned, with 17 new cases of the rapidly transmissible variant being detected in just the last 24 hours.
Yes, Rishika. So I first want to give you a tally of where each of these cases is, so we know where the virus is right now spreading as far as we know on the basis of genome sequencing data shared by the government. So 2 cases were in Karnataka, and one was a doctor with no travel history, and one has already left the country. He wasn't an Indian national. 1 in Gujarat, he was an elderly individual. 8 in Maharashtra, 9 in Jaipur, all from a wedding that was attended by someone who had just recently returned from South Africa. So these are all cases at a wedding. Then there is 1 in Delhi. This all takes the India's tally to 21, as you said. The Ministry of Health has actually indicated that there are more cases that they expect to detect in Rajasthan and in Delhi. Remember that the Rajasthan wedding was attended by around 100 people, but only 34 could be tested at the time and sequenced genomically, out of which 9 have come out positive. So there are more people who are going to be tested and genomically sequenced from this wedding in Jaipur, which will, the ministry expects, lead to more Omicron cases. Now, in light of all of this, the vaccination, the body that looks at vaccination and sees how the strategy of vaccination needs to be, is considering a booster dose for immunocompromised individuals. This comes after the INSACOG, the body that monitors mutations in the virus, that has been sharing all this data of the new Omicron variant, has actually recommended a booster dose. So there is panic slowly spreading, concern for this variant. We know so far that it's highly transmissible. As we can see, there were 17 cases in just the last 24 hours. These are cases that have actually been detected. We can be sure that there are more that have gone undetected. But we don't know how it affects disease severity, whether it does lead to hospitalizations or not. But to be safe, it's better to think of booster doses for people who have immunocompromised systems.
Well, absolutely, and the question of booster doses is, increasingly becoming an important one, Meher. Like you've been reporting, there is expected to be a meeting of the National Technical Advisory Group on Immunization today, and hopefully the Government of India will take a decision on booster shots, at least for frontline healthcare workers and those immunocompromised individuals. We'll track that story very closely.